Good morning.
Good morning.
Good morning. More than 75% of women eligible for breast reconstruction are not told about all of their options. October is Breast Cancer Awareness Month, and the American Society of Plastic Surgeons believes all women should be fully informed about their rights and options when it comes to reconstructive surgery. Former president of the American Society of Plastic Surgeons, Dr. David Song, and breast reconstructive patient Carin Silkaitis are here to educate our viewers on women's options for breast reconstruction. Carin, as someone who has undergone breast reconstruction, could you share your personal journey from diagnosis to reconstruction and how you returned to a confident, healthy life in the performing arts?
Sure, yeah, thank you. In 2009, I was diagnosed with the BRCA1 gene, or they call it BRCA. And I was given some very serious statistics about my likelihood of developing breast cancer. And at that point, I was working with a team of doctors. And a couple of years later, when it did look like I was developing early symptoms and signs of developing breast cancer, I worked with an American Society of Plastic Surgeons, plastic surgeon, along with this incredible team of doctors. And we decided at that point that I would undergo bilateral mastectomy and reconstruction. And so this incredible team of doctors presented all of my options to me. And we worked together to find a solution that worked for me and went along with my choices and my lifestyle as a performing artist. Afterwards, I felt like they made me feel whole again and I could get back to my life and my work.
That's great. Dr. Song, why do so many women feel misinformed about their options regarding breast reconstruction surgery?
Well, I think that in the throes of cancer, they're not getting all that information. So we at the American Society of Plastic Surgeons feel it's important to empower women with information. We were the ones that were pivotal in spearheading the Breast Cancer Patient Education Act, which mandates education for all women with breast cancer on their options. And so as a member of the American Society of Plastic Surgeons, as a breast reconstructive surgeon, the most important thing is to provide that information and choice so that women can make an informed decision.
Carin, what do you believe are some obstacles that women face when making the decision to undergo breast reconstruction surgery, and what are some of the positive effects that it does have on the lives of the survivors?
Sure, yeah, it's a great question. I think for me, some of the, I think obstacles for some women could be a lack of information. I felt very lucky that my board certified plastic surgeon presented me with so many options, and involving a plastic surgeon right away in the conversation for me was pivotal in making my decisions with me. They also gave me websites to look at, including breastreconusa.org. You can hear patient stories, you can look at photos. And I feel like go into this experience much more informed. So again, I feel very lucky that I involved my plastic surgeon right away, and I was able to get back to my life feeling whole, feeling alive, feeling like a woman again. So I felt really good about the information presented to me.
Thank you. Dr. Song, how important is it to include a plastic surgeon in your cancer care team, and what information should women be aware of regarding having breast reconstruction?
Well, breast cancer is such a complex disease and way of treating, and the treatment modalities are numerous, and so it's critical to have a plastic surgeon at the table as part of your team from the get-go, so that we can help provide a restoration and an empowerment of women feeling whole again after treatment. We'd like to say we want to see patients not just survive but thrive after breast cancer, and women can go to breastreconusa.org to once again get all the information about what it looks like, what it feels like, and how to generate the questions that will once again empower women to make the right informed choice.
Carin, is there anything you'd like to add?
Yeah, I have to say that, again, I feel lucky that I had a group of people working with me that allowed me to have very little downtime, be able to get back to my life again, and make me feel, I keep using the word whole, but that's exactly what happened. I felt like I was rebuilt, and you feel whole again.
Dr. Song, is there anything you'd like to add?
Again, I just want to stress that this is a choice for women. We want to make sure, as American Society of Plastic Surgeons member, that all patients get that choice and are informed of the choices that are available to them. So going to breastreconusa.org will really provide that information for women that are undergoing cancer treatment.
I'd like to thank you both for taking the time to talk with us today. Have a great day.
Thank you.
Thank
You
you.
too.
Welcome.